A 42-year-old female was riding a two-wheeler when she collided with another two-wheeler, fell down, and sustained an injury to her left shoulder. As you can see in this X-ray, it appears that the arm bone, the humerus, has dislocated from its socket, the glenoid, and also you can see a small chip of bone which is fractured from the humerus, which is nothing but something called the greater tuberosity of the humerus. Coming to the CT with the 3D reconstruction, you can see that the head of the humerus is clearly moved anteriorly to the glenoid. You can see a small fracture fragment denoted by the red arrow, which is a fracture of the greater tuberosity of the humerus, where a few of the rotator cuff muscles attach and it's displaced away from the main humerus bone. This is another view which is how it appears from the side of a 3D CT, and you can see clearly that the arm bone is moved anterior to the pear-shaped glenoid, which is depicted by the red arrow. So how do we treat this? The way to treat this is, first, since it's only a greater tuberosity fracture, we reduce it in the emergency room itself manually with a few maneuvers, and then we get another X-ray to see if the greater tuberosity of the humerus has been brought back into place or how much displacement there is. If the displacement is less than 5 mm, then, and if it's an older individual, less functional demands, we usually leave it, and it usually result in a good outcome. But if the displacement is greater than 3 mm in laborers, overhead workers, athletes, then it's better to fix it with a CC screw or a plate, depending on the size of the fragment. So in this situation, since it's a middle-aged female with good functional demands and the displacement is significant, greater than 5 millimeters, we decided to fix it with a CC screw and buttress it with a plate.